now joins us. Thank you for being here.
Thank you for having me.
And Dr. Bowman, I'm so happy we're talking about this because a lot of people have had UTIs and symptoms of that, but what you have to deal with, and any woman out there who has to deal with this, it can truly be debilitating.
Yes. During this time, I'm in so much pain. I'm going to the bathroom, 80 plus times a day. I'm, all down here, just severe, like a bowling ball with knives sticking out of your body. It's completely affected my life, and it goes around to my back. And I remember my urologist saying, okay, these are the things you might have. And I thought, I have cancer. This pain is so severe, it has to be cancer. And then when he told me that it wasn't, it was IC. It was almost worse.
Cancer, I think this is what you mean, you can get treated from, even though it's a life-threatening illness. This is something she's going to have for the rest of her life. It's a chronic inflammatory condition of the bladder that's debilitating. She can't have sexual relations with her husband. She can't play with her kids and jump on the trampoline. She can't run, which was a passion and a joy in the way that she was able to connect with God and nature and everything else.
But you can offer some solutions to improve the symptoms. Explain to folks, Dr. Berman, what we're talking about when we say IC or interstitial cystitis.
So as I said, it is an inflammatory condition of the bladder. We have our demo model here, and in the first one you can see there's a normal protein membrane that coats the bladder. And as urine goes into the bladder from your kidneys, it goes in there, and that nice coating is intact and protects the acidity and the components of urine from entering into the bladder interstitium, causing inflammation and pain. In the IC bladder, you can see that membrane is cracked a little bit. There's little micro tears, like a hard-boiled egg that you were to squeeze and it fractures. That's what an IC bladder looks like. That's what her bladder looks like. So when urine goes into her bladder from her kidneys, this is what happens. It leaks into the interstitial membrane, causing inflammation, irritation, and severe pain.
The interstitial cystitis is a lot like, there are a lot of illnesses out there, asthma, certain,
irritable bowel.
You're going to be with, they may be with you your whole life, but that doesn't mean that there's not hope. And I think that's a very, very important thing for you to grasp onto, as well as anyone out there who's dealing with this, because there are things that you can do to improve the symptoms.
There's medical treatments, alternative therapies, there's diet. Diet can exacerbate her symptoms, but I love what you said about hope, and we talked a lot about that. And I gave her a ring that says, love is my intention, where whenever she gets worried or stressed, because stress exacerbates these symptoms, she reminds herself that I'm going to be okay, that things are going to be okay, because hope, the way that our brain affects our health, is profound, especially with these chronic inflammatory diseases. So that's one thing we're working on. And
so let's go, before we hit break, Dr. Berman, what are a few things people can do at home, and also obviously Elizabeth, if they're suffering from
what
this?
Elizabeth's doing is dietary changes. There's certain foods that can exacerbate symptoms. There's a website that people can go to for resources. There's medications, one of them that functions to coat the bladder and protect the bladder and improve that protein membrane. There's supplements that are anti-inflammatory and antioxidants. And then there's the surgical sort of treatments. She's about to undergo something called hydrodistension, which is a procedure that involves putting a scope into the bladder, filling it. It needs to be done under anesthesia because she cannot tolerate filling of her bladder. So it's done under anesthesia. They're going to stretch her bladder, and what that does is it sort of causes the cracking, but it redistributes the nerve fibers. So it's a temporary solution for pain. She knows this, that it's not a cure. She may need to go back again for another one in 6 months or a year, but it is a temporary interim solution to help her pain, along with what she's doing in her head and her heart.
So you know now, and you believe that these symptoms can be greatly improved, right?
I do, and I just want to tell you guys, thank you so much, because a lot of people are out there trying to reach out to different shows, different celebrities, to have a voice, and you guys have done that for us, so thank you.
Well, thank you for